Berejiklian still facing the hard questions and hoping, like the rest of us, that the next 24, 48 hours that those hard measures do finally start to show up in the numbers. But she herself indicating she thinks the number will be higher tomorrow.
Yeah, it looks forlorn, doesn't it? And I think what's most concerning to me here, Kieran, is the numbers, they're supposed to be going down by now, no matter what the Premier says, even if it's slightly. It's not just that they're not going down. They're not stabilising. They're going up. And the infectious in the community figures going up. So, look, I asked her yesterday if she'd lost control, as Dan Andrews had accused her of. He says, we're running alongside the virus, we're trying to get past. He says it's too late for Sydney. And she fired up at that, said no. And Danica DiGiorgio, our reporter, asked the same today. Let's have a listen to both those exchanges.
Have we lost control?
No.
You keep saying that we haven't lost control of this outbreak. How can you continue to say that when all evidence, the case numbers, infections and the community delays all point to the fact that you have lost control of this outbreak?
On average, it's taking around 28 hours for people to get test results, and sometimes people are getting their test results sooner than that point in time. There was an issue with one private lab, I understand, which Dr Chant reported have since been managed. But I will ask Dr McAnulty to talk about that. He's well connected, not just in relation to the pathology labs and the testing, but also in our ability to get those venues of concern. But as I said, sometimes we need to go back because people might forget or not provide information at the time, and that's why we ask everybody to be alert to those venues of concern. It's not because our contact tracers don't necessarily get to them quickly, it's because people remember things subsequently, or else people may not have known they were infectious at a particular point in time.
Just feels a bit at the moment like Berejiklian, she's always blaming the public. I mean, there might be some good reason for that in terms of complying with health orders and that, but we've got other lockdowns under control with contact tracing and the like, and being policed. So I'd just like to see her take a bit more responsibility for the settings rather than saying they're always right, and just tell us what the plan is. My concern here is Gladys Berejiklian under a lot of pressure on construction. That's understandable. I don't think she should have shut the sites. I think she should have taken them back to 25% of the workforce like Victoria. She's committed, as I understand it, to lift that restriction July 31. That'll mean cases go up, no question about it. So we've got a lot of problems in Sydney coming forward, unfortunately. But she's still insisting here she's on the right path, Berejiklian.
You said that they would. You said that they would. You said that they would go down the number of cases under the more tougher restrictions. But in actual fact, they're going in the opposite direction. They're getting higher. So, are you comfortable with the current settings that are in place?
That's not exactly what I said. What I did say is we won't know what impact those harsher restrictions have had until at least the weekend or early next week. So we'll be in a better position then to assess. But what I do know is the fact that we stopped literally tens of thousands, if not hundreds of thousands of people moving around at multiple sites would have resulted us in having far more, or would result in us having literally thousands of cases. So we know when we stop people moving around, when we ask people to stay at home, it does have an impact, because the alternative would have been thousands and thousands of cases. And cases
are going higher though. They're going in the other direction though. That's the issue.
No, well, exactly, because as I said, the impact of those harsher restrictions won't be felt. The extent of those won't be felt until at least the weekend or early next week. But it doesn't mean we won't have similar numbers potentially. That's up to all of us. What if people start getting more active and more mobile? We don't want them to do that.